Hello my dear student, welcome to Medical Anatomy. Today we are going to discuss about questions, Ospe questions related with bony articulated hands. Okay, so we know already bones. There are three segmental bones: carpal, metacarpal and phalanges. So first we will be starting to discuss about carpal related questions. Carpals we are asking here usually here by again marking. A common marked bones is this one. So here if we are marked and we are asking you identify these bones, you have to first check that where is the first row. So this is scaphoid, this is lunate, this is triquetral, then this is pisiform. So pisiform this is scaphoid, lunate, triquetral, over triquetral it is sitting. So this is the pisiform bones. Next question they may ask you that from which tendon these bones is developing. Answer should be flexor carpi ulnaris. So first questions, identify these bones. This is pisiform bones and these bones is developing from a tendon of flexor carpi ulnaris. Other questions we may ask you in general, just keeping this articulated hand in station, that carpals, these all carpals, they are what type of bones? So answer should be carpals are short bones except pisiform. Pisiform is a sesamoid bones. Then we also may ask you identify the largest carpals or write down the largest carpal's name. You should remember that the largest carpal is capitate. Then we may even also ask you which carpals commonly get dislocates. You have to say that answer should be lunate. Then which carpals commonly have avascular necrosis history? That should be scaphoid. Another questions we are asking related with the hook of the hamate. Maybe we can here mark and we ask you identify this part of the bones and what structure passes in relation with these bones. So this is the hook of the hamate. So you can see trapezium, trapezoid, capitate, and there is only one bones who have such type of one hook projection. So this is the hook of the hamate. So what tendon passes through this hook of the hamate? This hook of the hamate's area will be closely related with flexor carpi ulnaris and hypothenar muscles. What are the hypothenar muscles? Opponents digiti minimi, flexor digiti minimi brevis and abductor digiti minimi. These carpals, when we are saying scaphoid and lunate, we know it is articulating with the lower end of the radius. So here if you see these two articulated hands side by side, so this is scaphoid and this is the lunate. So which is articulating with the lower surface of radius. So as it is the inferior surface of the radius articulating with the scaphoid and lunate, it is forming radiocarpal joint. Radiocarpal joint is a condylar variety of synovial joint. Then these two rows carpal also they are making joints. We are saying it is called intercarpal joint. If in Ospe there is a questions, this intercarpal joint, what type of joint? You have to say intercarpal joints are plain type of synovial joint. After carpal, we will be heading for metacarpals. We know there are 5 metacarpals: first, second, third, fourth and fifth. Usually we are marking in the first metacarpal and we are asking identify these metacarpals. Here also we can mark like this way and ask you identify these metacarpals. This is the pollock side or thumb side. So this is the first metacarpal. And we can write that, we can ask you the questions that say some characteristic features of first metacarpal. So you have to write that compared with the other metacarpals, you can see it is short and stout. So you will be writing characteristic features of first metacarpal is it is short, it is stout, and epiphyses of other metacarpals are located in the distal area, that means head of the metacarpals, but in case of this first metacarpal it should be located into the base area. Okay, so questions will be identify the metacarpals and characteristic feature of the metacarpals, where is the location of its secondary ossification center. So you have to say this is first metacarpal, it is short and stout and the secondary ossification should be located into the base of the first metacarpal. Keep in mind, in addition to that, in this first metacarpal head area, there will be the location of two sesamoid bones in between the abductor pollicis and flexor pollicis brevis. Now, metacarpal and phalanges, there will be metacarpophalangeal joint, which is a condylar variety of synovial joint. And we know interphalangeal joints, it is hinge variety of synovial joints. Here, one more question is also related with the fifth metacarpal. Sometimes we are asking, we are marking here a demarcation. This is the fifth metacarpal and head of the fifth metacarpal. From the shaft of the fifth metacarpal, if head is separated, that means fractured. What is the name of this fracture? We are saying it is called boxer fracture. So this is also a point of Ospe questions. There is one more also area of fractures in the first metacarpal we are getting. Maybe we can here mark and ask that commonest fractures in the first metacarpal close to the base. What is the name of this fracture? You have to say it is called Bennett's fracture. In these distal phalanges, we can mark and we can ask you that extrinsic muscles of the hand, which will be here inserted. Write down the name. Answer should be flexor digitorum profundus. You just remember flexor digitorum profundus is the extrinsic muscles of the hand. From these muscles, one intrinsic muscles is also originating in hand. Name of that is called lumbricals. Now we will be going to discuss about the ossification center related with these short long bones. Usually we know if we do comparison with a long bone it has two epiphyses and a middle diaphysis, and epiphysis contains secondary ossification center. But in case of short long bone, there are single epiphysis contain secondary ossification center. If we see the metacarpals, in case of first metacarpals, the location of ossification center, secondary ossification center will be into the base area. And remaining metacarpals, their secondary ossification center will be into the head area. And remaining all the other short long bones, that means the phalanges, their ossification center will be located into the base area. Okay. So if in Ospe any one bones they are marking, for example, these bones marked and ask, identify these phalanges and where will be the location of secondary ossification center. So this is the proximal phalanges, and its ossification center will be located into the base. And if any metacarpals other than first we mark and ask, identify this metacarpal, where is the location of secondary ossification center? You have to say this is the third metacarpal. The secondary ossification center is located into the head area. Thank you.